My name is Caitlin Grant, and I'm the Programme Manager for the East of England Population Health Research Hub. And I'd like to introduce you to our two fantastic speakers. We have Wendy Wills and Amanda Wellings, who are presenting today on the topic of developing evaluation findings to create impact. Wendy Wills is a Professor of Food and Public Health and Director of the Centre for Research in Public Health and Community Care at the University of Hertfordshire. She co-leads FIRST Connect and is the incoming director of the NIHR Applied Research Collaboration for the East of England, so congratulations. She has been involved in evaluation research for national and local government, as well as third sector organisations. We're also delighted to have Amanda Wellings. Amanda is a self-employed public and patient involvement consultant. Amanda is a lifelong family carer and service user, has vast experience of health and social care, and is an all-round passionate advocate for PPI and research. Amanda has worked as a consultant for the NIHR Centre for Engagement and Dissemination, has been an NIHR Involve Advisory Group member, is a core panel member of NIHR funding streams, and was a founding member of the Norfolk PPI group, PPI Res. Amanda is also the public co-applicant of the NIHR FIRST programme, which they'll be talking to you about today. So Amanda and Wendy, I'll hand over to you. Thank you very much.
Thank you very much, Caitlin, and thank you all for coming today. We're really looking forward to talking to you today about how to generate and create evaluation findings that will ultimately have impact. And we are drawing heavily on the public health intervention responsive studies team work that Amanda and I are both involved with, and we'll say a bit more about that in a moment. We're going to set you, slides going. Just for those of you with any experience of trying to use evaluations and create impact, we thought we'd set a few questions for you to just ponder on as we talk today, and you can feed in at the end, or you can contact us separately. So what do you think impact should look like from evaluations? Is it something you've really given any thought to? How do you currently disseminate evaluation findings? Is dissemination different to impact? What is the route between the two? And at what point do you decide which stakeholders you're actually trying to impact on with an evaluation? Is that something that you give a great deal of thought to? How widely do you think about stakeholder groups? So that's something for you to think about. And now I'll move on to talk about the FIRST, the Public Health Intervention Responsive Studies team. The FIRSTs were set up in August 2020, funded by the National Institute for Health and Care Research, and there are now 6 FIRSTs. We're called FIRST Connect, co-led by myself and Catherine Brown from the University of Hertfordshire with other partners. So the FIRST scheme offers a responsive framework for co-creating evaluations undertaken with local authority partners and external stakeholders, including the public, which aims to generate timely and accessible findings to support policy and practice decisions. And you can see some of the sort of core principles of FIRST on there, and each FIRST will undertake 10 evaluation projects over 5 years. We're already on project number 6, so they're all happening sort of simultaneously. And the FIRST do give us opportunity to synthesize knowledge obtained from these various simultaneous evaluations undertaken in diverse contexts. So we can we're more than the sum of the individual parts. It really gives us an opportunity to advance understanding of knowledge mobilisation processes. Each FIRST has it within their gift to think about how they want to generate and use knowledge and create impact from it. We don't all have to do it the same. And so we do really have potential for start sharing best practice knowledge mobilisation examples, and we're here today to do that can be shared within and beyond the FIRST programme to create impact on public health. Co-production, as you can see on the screen, is a really key principle and part of what we do, and involving as many different stakeholders as possible, which we do to greater or lesser extent on each project. So within FIRST Connect, we've established a knowledge mobilisation approach that has different elements to it. Some people call them different steps. You'll see as we go along whether you think it's a stepped approach or just different elements, and we're going to talk those through with you before Amanda brings it all to life and shows you some examples of how we're trying to go through the pipeline from knowledge mobilisation to creating impact. So firstly, how do we define knowledge mobilisation versus implementation versus impact? And when I was thinking about this, I'm thinking, is this on a continuum? Is it perhaps a loop? That's why I put that image on the screen, because it's not always a one-directional process. It's iterative, it changes all the time, as you'll see as we talk through things today. So in terms of how we define knowledge mobilisation, at least, we see it as a dynamic and interactive process which ensures that public investments in research deliver the greatest possible benefits. Knowledge mobilisation should bring a wide range of key stakeholders together, not only to generate and answer research questions, but then help to facilitate the best use of research knowledge in multiple ways, tailored to diverse audiences to inform decision-making and facilitate implementation of findings to create impact in our region. Whereas implementation is the process of then putting an intervention or a key recommendation into action based on robust research evidence. So rolling out a new or improved approach in practice in the real world settings in which we all work. Impact can be defined as an effect on, a change to, or a benefit to the economy, society or culture, to public policy or services, to health, the environment or quality of life. But beyond academia. When we talk about impact, we're not talking about journal articles and how many academics might have read them. So within First Connect, we feel it's really important to consider all three of these elements to maximise the impact you ultimately are aiming to have. And our first approach to knowledge mobilisation includes considering what, who, why, before getting into the how to turn knowledge into impact. What are your key messages? Who are the beneficiaries and why might they be interested in your evaluation findings? So I'm going to talk through each of those elements in a bit more detail now. So in terms of what are the key messages from your evaluation research? Once we started to really think about how we were going to do this from each of our evaluations in FIRST, we realised it's really important to break down the findings, and all of our stakeholder partners told us, please be very specific about what the recommendations are so that we know exactly what it is we're trying to put into practice. And you have to prioritise. There's a lot of key findings that come from an evaluation often, and you're perhaps not going to be able to work with all of those to turn them into something that's used that might be a legacy beyond the scope of what you're able to do. What are the external influences and factors that affect mobilising that knowledge? This is really important, and we've found that using what we call, is a PESTLE tool. So PESTLE stands for political, economic, social, technological, legal and environmental, and you might also add industrial, in terms of different factors and influences. Think through, and we literally have lots of sort of tables and spreadsheets when we work with this on our projects, and we do this right from the beginning of a project with all of the different stakeholders involved to get them thinking early. What are going to be the political, economic, social, etc. strengths, weaknesses, opportunities and threats that are going to be barriers or enablers to you mobilising knowledge from your project.
And remember, Wendy, one of the stakeholders has definitely got to be members of the public from that initial developing the ideas of what we want to mobilise.
Yeah, absolutely. Thanks, Amanda. And Amanda always brings the public lens to everything we do with huge benefit, as you'll see by the end of this presentation. Next, we go on to think about who the target beneficiaries are. And again, it's really important to be specific, write it down, put it into a table, put it into a spreadsheet and consult widely who are the different target beneficiaries, national, international organisations and agencies, local organisations, the different public beneficiaries, whether it's particular service user or population groups, and the wider general public. And who might some of the individual sort of key influences, key figures, representatives might be who are going to be interested or influential in your research, whether that's a community champion, whether it's a head teacher, whether it's a director of public health, whether it's a leader, a hospital, really interested in community health. Who are those people? Because you're going to need to mobilise some of those when you're trying to mobilise knowledge from your work. And then why? Why might people be interested in these key findings? And again, it's important to be specific and think through who is going to be interested, who has influence, What is the significance or relevance for them? Is this a whole new way of working that you're going to be proposing, or is it actually just a tweak to sort of current practice? Does that make it any more or less sort of interest to different stakeholders? What's the scope and the applicability? Again, the more that you can be specific and work within these kind of different elements, the more likely you are to sort of maximize the success that you can have. And so we tend to use this kind of matrix diagram to sort of plot out. And this again is really dynamic. It changes throughout the lifetime of a project. There might be a group of people that you consider would be influential, but they have very little interest. How can you make sure they become interested so that you can mobilize their influence on what you're trying to enact from the research? So map it all out, have all of this within a template document, and make sure, again, we'll keep saying it, but consult widely about this and revisit it. It's really important that you revisit this to see how people might have changed or moved around that matrix in terms of levels of interest and influence.
It's sometimes not until you work within the organisation that you realise who the real influencers are. So at the beginning, you may have your ideas, oh, it's obviously going to be the head of this organisation, but it might actually be someone that you don't actually realise. So yeah, this chart can move quite a lot during the process of doing an evaluation.
Yeah, thank you. And I think we've found that starting to do this on each of our projects now, we're starting it earlier and earlier. So now it comes in at the very first meeting we have with different stakeholders about an evaluation, whereas we used to start it later, means that you're sort of really considering those barriers and enablers to implementation of findings to sort of reduce the chance of disappointment. And disappointment can be from the evaluation team, it can be the local authority, it can be the general public or the population groups you're working with. Going through this process means that you sort of reduce those chances of disappointment and manage expectations, because the expectations of different stakeholder groups can be really quite different and might be sort of completely out of scope for what you're actually going to be able to achieve. So what does this look like? So I know this is a bit busy, but this is just, and we're going to use now a lot of examples from our PHIRST project, which was an evaluation for Leeds City Council looking at the move to remote delivery of drug and alcohol services right from the start of the COVID pandemic. So it's called the DASE project for short. So this is our sort of oldest project in terms of starting back in 2020. So this has been a very dynamic process that's involved lots of different stages, going back, considering what are the key messages. And Amanda's going to talk you through how we redid that again, even at the various points when we thought we had the key messages that were going to be mobilised, thinking through the significance and the relevance, the scope, and then the different organisations, and again, all the different stakeholders in Leeds. And we have a really dynamic sort of advisory group in Leeds with people from the sort of local patch as well as nationally who are interested in the findings from this evaluation, have really helped us to sort of revise who the organisations are and then prioritise where the messages are going to be heading and what impact that we're trying to have. So before I hand over to Amanda to talk you through some of the ways that we're enacting some of this, does anybody have any sort of questions or things they want clarity on before we move on? People might need to shout if they do, because I can't see.
Yeah, feel free to unmute yourself and let Wendy know if you've got a question, or you can post it in the chat. There's nothing in the chat at the moment, Wendy.
Okay, thank you. Okay, let's move on then. So I'll hand over to Amanda now to start thinking about how you turn knowledge into something that can create impact.
Thank you, Wendy. There's all different ways of how to turn knowledge into impact. And you've got your normal, you've got workshops, publications, the journal article. There's loads of different ways. But I'm very passionate about the creative part. So part of what I do is a lot about doing creative stuff. So the creative approaches, we actually went up to service users in Leeds. This was sort of a few months ago. So after COVID, problems had sort of started to wane, and we could actually get up there. We did two two lots of 2 sessions, visiting 2 different groups of service users. So we did Forward Leeds, who are people who have drug and alcohol support needs. And we did Basis Leeds, which are actually their female sex workers. And I'm now going to be bombed by a cat. I do apologise, but he always comes to all my meetings. So yeah, we've worked with 2 different organisations. So next slide. How we did it was we developed with our PPI group that we have all the time in the PHIRST, which is the First Connect patient involvement in research group, which is 10 people, and they helped us to put the key messages in a way that would be understandable to service users and the public. So we took these key messages to Leeds in 2 separate groups, in the 2 separate with the 2 separate people, and we got them to sense check what they thought about our key messages. So that was the first session, and then the second session, we then updated the key messages. We took them back to them as to what we were going to do with what they'd said. And we then all got creative to find ways of how we want to shout these messages out at the end in a way that was really accessible. So one of the main messages was about wanting to keep a mixed or hybrid service going forward. And our data showed that many service users liked the remote service and they brought a number of benefits, but it was not right for everyone, and some services couldn't be delivered remotely. And as we discovered most by working with the drug and alcohol service users who were also sex workers, they actually really needed people to go and see them in person in their homes, was what was easier for them a lot of the time for their drug and alcohol services. Next slide, please, Wendy. It's amazing how I can do this with a cat. One of the things that we did do was, it was the morning of the event, and I was at something, and they were talking about using a tree and putting leaves on a tree for ideas. And me being a poet, I decided to call it the creativity tree. And we used that with the service users. So as everyone in the room had a voice, we had members of our team were actually writing things down for people who didn't want to write, and they had discussions and they put all their ideas onto the creativity tree. And that actually gave us more data, and it meant that we could talk to the sex worker drug and alcohol service users where they were seen as hard to reach and underserved community. But by doing things this way and actually opening up a dialogue and a chat with them, we got more data. I'll bring in the fact that I'm actually an ex-alcohol user myself, so I could relate to them, and because they had someone that understood what it was like for them, it was really easy for them to sort of talk to the group and sort of be really, really frank with their ideas. And so we gained a lot. Next slide. So part of what I did with the group in Leeds was I used what's known as found poetry. And what it is you ask people for ideas about from what they've read, say they'll come up with a line or an idea. And also part of it is listening to what's happening in the room and listening to what people are saying and looking at what's going on. And so while I was in the room, I was listening and I was getting ideas from people, and I was writing the poetry as we were in the room and feeding back how I was going to relate what the people said in the form of poetry. So I had it 3/4 written by the time we'd finished that session, and I'd asked all the ladies whether it was okay for me to write what they'd said in the way that I had. So that felt really good to me. So what I'm going to do now, with the aid of Wendy changing the slides for me at the beginning of each verse, is I'm going to go through the poem that came out of it. And also within the poem, there's some artwork. Some of it is artwork that was done by the team. And there's also sort of other images as well that support the poetry. And I think it's really, really good to have images and words together. It gives you a real impactful thing at the end. So next slide, and I shall begin. BASIS, leading drug and alcohol support. Bay sisters, not just surviving, living. Soldiers battling a war of misfortunes, peace by mutual understanding. Rid war of judgment and prejudices. The she was culture, trapped, unable to move beyond their pasts. You're pretty, yes, pretty annoying, but free to be me here. Lionesses learn to take pride. Next slide. BASIS, help meet basic needs, food, toiletries, clothes, companionship, activities. Anyone need deodorant, shower gel, shampoo, new underwear? Food donated to share, knowing there are still people who care. Free donated clothes, rail browsed. Better than a catalogue, this, designer labels. Do you want this leopard skin print top? I love a bit of Vera Duckworth, me. BASIS, helping create a positive outlook. Some people are challenging to those trying to grow. Wish you would get in your plant pot and grow the fuck up. Moving past previous fuck ups, growing confidence, skills and ability. Creative activity needed. Growing plants, cooking on a budget. Mindfulness, colouring and crafts, calm, chaotic mind. Ugh, get that word out. Problems drift. What? No pink? Go where the happy people are. I like the weirdos, the alternative people. BASIS, saving lost souls. A shoulder to cry on and release some of the burdens. Need music, dance, sing, happy times, not just wallowing in others' problems. Companionship, wind to power my ship, noisy verbal hot air balloon helping me to fly, find my natural safe highs. Dozen years been coming here for when it was an egg. It's all it's cracked up to be, laughter, having a joke. Next slide. So as you can see by the poetry and whatever, we are thinking outside the box when we're working out how to share our ideas. And I'd like to share a few quotes about what it was like going up and working with the service users. And one of them is from our research assistant, Caris, and she's a very, very young new researcher. And she just said it was lovely going up and doing the creative outputs because it allowed her to see a side of them that she wouldn't have seen using traditional methods. Yeah, we all laughed and we got to know each other. And the outputs were a reflection of all the fascinating voices in the room. And I think the poem brings to life what it's like for those ladies. And then we've got Dan Byrne, who's the Health Improvement Principal of Leeds City Council. He wanted us to do more around understanding the sex workers' needs and was really pleased that we'd actually gone in and managed to get more data from them by doing the creative stuff. And he says working with the University of Hertford in collaboration with service users and Leeds has been a unique learning experience. And he knows that he can remove the remote delivery service to what people would need in a real world environment, and that's what evaluation is really about. And I know that part of the dissemination, we're going to go up and talk to people that are in charge of commissioning drug and alcohol services across the whole of the country. So that's one of the events that we're going to, and hopefully we'll take the poem there as well. So next slide. We've also done other things, so it's not all art and poems, unfortunately, because that's the bits that I enjoy the most. But we've produced infographics as well, but this is a draft infographic because as I pointed out to the group, it hasn't been back to service users yet to see whether they like it, and that's a real necessary part of the full picture, is to get any piece of dissemination looked at by your service user group, because they can do things that other people wouldn't actually see, and look at the common sense in what you're saying and how it feels to them.
And also just to mention there as well, because we're really interested in sort of increasing accessibility of all of our outputs. So we'll have these infographics with key findings, but we're also going to do a sort of an audio overlay of it, so people who want to listen to the findings rather than read or do both, to try and sort of increase how people engage with things like this. So we're really trying a lot of different approaches to how we maximize the impact.
Thank you, Wendy. Yeah. So the lessons that we learned from doing this work, a range of voices are really important in shaping diverse project outputs, because without the voice of those female sex workers, we'd never have a line like, wish you would get in your plant pot and grow the fuck up. But that's their life. That's how they live. And that brings things to life. So it is really important in thinking about the range of voices that you're going to get. Then conversations with diverse groups. So as we do produce accessible outputs for all, and that's been really, really important in our PHIRST, and we've actually done training around how to do dissemination that's more accessible to a wider audience. Flexibility of the research team is important, and that the activities and outputs are tailored to both the audience and the context. So it's pointless doing lovely outputs that are not actually tailored to an audience or tailored to a context in which you're working. And the level of risk is interesting, because when we first went up to work with the sex workers up in Leeds, we arrived and they'd been invited to a session, and 4 of them turned up, and there were 5 of us. And we had the key messages that we were going to work on tables with the amount of ladies that we were told would turn up. And in the end, we had to throw that away and just sit and work on a table and just talk to the ladies. It was really good, but I felt that there was a little bit of a power dynamic going on, because there was 5 of us and 4 of them, and basically we were 3 of us sort of sat and took notes, because they didn't want to overwhelm what was going on by adding their bits in the conversation as well. And I sort of led the conversation mostly by being an ex-service user. So it was kind of strange, that session. But then when we went up, we just went to one of their drop-in sessions. We got more ladies. We fed them lunch first. And we were just more willing to go with the flow and do it how they wanted to do it. And I think that way really, really worked. So yeah, activities don't always go to your plans. You can never judge what a room's going to be like until you walk into it. And I've had background working in dialogue groups in prisons and whatever. So I know how to sort of judge the emotions and what's happening in a room, and how to deal with people who may have different needs. So that's part of the expertise that I bring to the group, and being a bridge between the researchers and the service users, which I think is really important. Next slide.
I'll just add a couple of things there, Amanda. I mean, in terms of accessibility and the range of voices, I mean, this has just become so apparent that our team did have some training on accessibility, and that was led with somebody who was visually impaired, and even understanding sort of his needs. We were quite fascinated by how he could engage with the training we were doing. Made us really think about, when do you use a PDF, when do you need an audio sort of voiceover, what different things work for different people. And that's not so that we try to only aim it at people that are visually impaired. It makes things sort of more widely, universally accessible. And I guess that's what we're aiming at. It's the more voices and the more experiences that you can feed into to the potential uses of the research findings, the more likely you are to create impact and for it to be memorable. And I think partly this idea that activities don't go to plan and what level of risk is acceptable, there almost needs to be a sort of shift in mindset. I think once you start accepting that members of the public, different service user populations, community groups always need to be part of evaluations right from the start, and you have to sort of change the mindset to accepting that can be quite messy, it can be quite slow. As Amanda said, it doesn't go to plan, but it is still really important to do it. And it's trying to match the different time scales of, you know, sometimes I have in my head, there's the Ferrari of kind of public health wanting to sort of speed ahead at 100 miles an hour and get your key performance indicators and tick off that you've done something, versus sort of working with different service users groups, being in a sort of classic vintage car that's never going to go more than 30 miles an hour. You know, both great vehicles, you've just got to find a way of bringing them together so that, again, you maximize the sort of impact you're going to have from research, which is what I think makes it quite fascinating, especially working with somebody as creative as Amanda. What is next? Impact. Shall I talk to this one for?
Yeah, you can do. Yeah.
So in terms of impact, which of course is something lots of us have to sort of grapple with, and when you're doing this kind of research, when you really are trying to co-produce and involve a wide range of stakeholders, I think we all need to become a lot more comfortable with the different types of impact, not just hard indicators, you know, changes in BMI or prevalence of diabetes or rates of smoking and those kind of things, which we all know can take many, many, many years. But thinking about some of what we might call softer impact, I really need to find a better term than that. And what indicators do local residents think are important to measure? Because this has come up at a few different workshops we've done recently. You know, you've got key performance indicators. If you commission a service, you need to demonstrate that impact or improvements have been made, but actually, are they the indicators that people locally, different service user population groups would pick? And do you know the answer to that? Because I think many of us don't. And the feeding back to people involved, either as research participants or those sort of informing the way the research is undertaken, is the gold standard that everybody should be aiming for. We haven't got time to play you we've got a little video of that, of people saying, some of the service users that Amanda and others in our team met with sort of saying, yeah, I think they really did listen to us. It wasn't a box ticking exercise. They genuinely reflected back what we said into the updated version of the key findings. You know, giving that feedback and making people feel it's worth speaking up and engaging with research is part of our job. And building those relationships is a crucial impact indicator, in my view. And the more that we build those relationships with different stakeholders, the more it means we can follow the impact as it occurs, because we're sort of embedded with the communities and the community organisations and different patient population groups that we're trying to achieve impact for and with. So all of those things are important in terms of impact, and certainly within the ARC as well as the FIRST, you know, it's something that I think we need to drive forward, because we will sort of see greater results down the line. I meant to say at the beginning, before I put the next slide up, try and consider what the elephant in the room is before we get to the picture of the elephant in the room. But that is about, and I'll let Amanda speak to this, but resourcing co-production as part of your impact and dissemination plan. You know, it's absolutely crucial, as you're probably getting that message from us both, and always needs to be included. It's not enough, I think, to say it's too messy, it's too complex, it's too time consuming, or we don't have a budget. Amanda, I'll let you talk through the other bullet point.
Yeah, this slide is, I mean, years ago when I was working with National Institute of Health Research, involved the big organisation who helped researchers. I produced a guide called Starting Out, or co-produced it, and it was really good because it's just the key things that you need to go through before you involve service users. And it was actually produced as an induction for service users coming and helping in research. But I think it got used a lot by researchers to understand what they need to give us. But we service users and members of the public come as a critical friend. They come as an independent voice. They come as somebody who's able to raise the elephant in the room that perhaps you may not be able to raise, being employed by a certain organisation. So it does have a lot of value in an impact plan, because you could be doing an impact plan where you've decided that you need to do something, and then the elephant in the room might be a service user saying, well, if you do it like that, that won't fit what I need. It won't fit my disability. It won't fit my needs. So it's always a part of an impact plan. Has to be part of what you need to do for your job, but it also has to be part of what the public needs out of it at the end. Because remember, all the way through, this is public health, so the public should have quite a big voice in what that looks like.
And so we've got processes on there, because although it's it can be very bureaucratic, involving service users, but it has to be done. We have to have ways of always paying people for their involvement in our sort of research and design and evaluation services. At the University of Hertfordshire, we have really well-established processes and people with real expertise in guiding service users as to the different ways that they might be able to claim for their time, because it's not straightforward. So that's something to think about in terms of infrastructure, and whether within local authorities, if you don't have direct access to that, whether you can work with a university partner, because I think all of the universities in the region do have public involvement and patient involvement groups. And it's working out how you're best going to support service users and members of the public to be involved and to engage, whether it's throughout research or whether it's to, you know, be involved in dissemination at the end. And thinking that through, and not thinking you're going to put a token member of the public onto some steering group or group about impact, because quite often that doesn't work well. You need to have more than one person, and you need to consider whether they can engage with Zoom versus Teams versus a phone call versus an in-person meeting. So it does all require a lot of thought, but it's really invaluable when you do it, and when you do it well.
And it's also, it's if you just have your goal of having one service user on a committee, there's only certain people that cope with committee work. And I mean, I know over the years I've been in various committees and various, if you're the lone person in that room, it can be incredibly scary, and it can take you a few months before you even feel okay to actually speak out. So I think support is really, really important with whatever you do with your service users and your members of the public. Make sure that they're happy, make sure that their needs are supported, make sure that they feel valued, and that what they're giving to you is acted on, and that they get feedback as to how they're doing and what they've changed by being there.
Thank you.
I need to say.
And that is our last slide. So when you get the slide pack, it's got mine and Amanda's contact details, and our first website is finally being launched this Friday. So that web link is not live until Friday, but at that point you will have all the details about all 6 FIRSTs and their evaluation projects. And Amanda's designed and written and co-produced the sort of public involvement section of the website, so that it'll be a lot easier to find out details about what we all do. So thank you all very much. I'll stop sharing, and we've got time for questions and comments.
Fantastic presentation. Thank you both. Just to let you know, Amanda, we did have some virtual claps after your reading of your poem. So thank you for that. I think the participants enjoyed. I don't know. I don't think you can see the comments. And we do have a few questions in the chat. So if you've got time, we might address a few of those now. So Lawrence was asking, saying, firstly, the leaflets look good. Do you include a budget for Graphist in your grant? And I suppose a general question about budgeting for creative outputs. And if I can add to that as well, how do you sort of evaluate the impact of creative outputs that you generate as well?
Good questions. Yes, Laurence, we do budget. And that is quite tricky because sometimes, again, at the outset, you don't know what outputs you're going to be aiming for, so you don't know how much they're going to cost. And again, I think on various projects, not just the first ones, there's been times, I think, when we've been caught out because the ambition doesn't match the budget. So you've got to put something in there, even when you don't quite know where you're going with it. And again, not assume, I mean, I remember saying to Amanda, I can't remember what we were at, where she said, well, I'm the resident poet, so my time is free. It's like, well, no, it isn't. Because there should, you know, we value that input, and therefore somehow you've got to work out how to do that. And obviously that can be quite expensive, but
it can be cheap though. It can be done on a reasonably small budget, because I think those I think the posters were done by graphics, but a lot of things we've done using Canva. We've done videos where we've just done a Zoom and recorded the Zoom, and that becomes a video that goes towards a poem, because we sent one off to the British MedSoc Association that had a Star Trek theme, and it was all members of our team just reading out different bits of the poem, and that was done in an hour over Zoom. So you can, providing you're not thinking it has to be perfect, it has to be shiny, it has to be wonderful. No, it just has to get the message across in the end. Yeah. So sometimes you don't need as big a budget as you think. Yeah,
very good point. And actually, I have to say, sometimes I've put a bigger budget against things that don't turn out as engaging as some of the things that you've just mentioned, where we can sort of do it within the team. So yeah, good point. And in terms of how we're going to measure the impact of these outputs, that is a really good question. And obviously at the sort of point we're at in the lifetime of PHIRST, and what we can achieve within the lifetime of each FIRST project is something that we're discussing with NIHR. And I think, again, some of this is comes back to those relationships that might have been built along the way, because some of this will have to happen without the FIRST being directly involved, that kind of legacy of people wanting to follow through, wanting to make sure that similar creativity happens and engagement with service users to create an impact. Yeah, because I think that is something now that we do need to, we've got this far with our knowledge mobilisation strategy and approach, and embedding the sort of service user involvement throughout, but how we measure that impact, I have to say, is the next bit, in conjunction with the other FIRSTs, because we're kind of pool ideas for that.
Yeah, we know some of the impact of sort of like the first poem, because that went to the MedSoc conference, and then we had people from the MedSoc conference asking me things about the poem and saying things about the poem and whatever. So we realised it had quite a good reach, and that was just sort of our first toe in the water doing something like that. So it's all new. So really, creativity in research is still quite in its infancy. So we're not quite sure of impact now yet, but it's a different way of looking at something. And I think if you present things in a different way, they're more likely to get noticed. And so you could get more impact just by the fact that somebody's noticed how you've done something. So yeah, I think I'm hoping it has a big impact. But I think it has, because quite a few people. I mean, I did actually do a rendition of the poem in a pub, because I do stand up in a pub, and it's sort of poetry cross stand-up comedian, and I actually did that in the pub, and quite a few people come up to me afterwards and said, what a brilliant way to talk about research.
Yeah.
So it's getting it out to a wider audience and getting out ideas. You can talk about what public health is. If you put it on a screen in black and white and just have this is what public health is, people might notice it. But if you put it in a creative form, people are more likely to remember it or want to engage with it. That's how I feel anyway. But I'm also autistic. So whether my brain functions in the same way as how other people feel, I don't know. But I just go with it. And my team encouraged me to be wacky and to do things that my neurotypical brain naturally does.
Mm.
No, neurodiverse brain, not neurotypical. But
Yeah.
Never been neurotypical, but yeah.
But also there's been impact. I mean, the Dan Byrne, who we put a quote up from earlier at Leeds City Council, because he's seen some of the outputs we're producing, he has encouraged us to disseminate to and speak with different groups. And as Amanda said, he became interested in what the work that we've done with the sex workers and how they can really understand sort of groups that ordinarily are sort of harder to sort of engage with because of the ways that they've been engaged with in the past. So I think there's impact even within the impact almost, you know, of the different ways and the different stakeholder groups nationally and locally that we're being asked to engage with. So there's a lot of potential there. And we do keep a sort of issue log of engagement, conversations, things that have come up as one small way of sort of measuring what the impact is. But yeah, that's something we're going to have to come back to a bit more.
That sounds good. Thank you. Maybe Laurence, do you want to unmute and just ask your question about decision making and impact?
Yes, because actually it links well. Thank you, Wendy and Amanda, for this presentation. The examples are very concrete. It makes it easier to understand what you've done. So I'm actually, the way you speak, I understand the impact you're working on at the moment is maybe more to raise awareness of issues and of some groups. And I also, I mean, in an ideal world, research informs decision making, which obviously cannot happen all the time. But I'm wondering, and it's also, I mean, first, it cannot happen all the time, and it's harder. It's hard to measure sometimes. But since you're working with service providers and some decision makers in your projects, I'm just wondering if this is something that you are also seeking to do and to track, like how to not only raise awareness of the people, but also how to raise awareness of the decision makers themselves and services.
Yeah, thank you. No, that is definitely something we're aiming at. It's not only raising awareness for the benefit of service users and engaging them, it is about impacting on those service providers and commissioners of services. And I mean, quite often the FIRST, local authorities asked to be evaluated by the FIRST because there's a recommissioning process coming up for a service, you know, and they're trying to plan ahead and get some evidence to help inform that process. So, I mean, we really are expecting that we will see impact on service providers and the commissioning of services. And I think, again, because of our sort of dissemination template that we talked about, those different steps, we have a database of people interested in our specific projects and people we've engaged with, so that we can keep in touch with them over time and perhaps get an update, or we are planning to get an update further down the line as to say, remember those findings, what did you actually do with them and how did it inform recommissioning or, you know, rethinking through a service. So we absolutely are expecting that there will be impact there, I have to say. There's
already been one bit of impact because, and I think it just happened, it just happened possibly by accident, I'm not sure, but between the going up and sharing the key findings with the drug and alcohol service users, one of the key findings was actually enacted by the commissioners. So one of them was that people wanted more home visits, and there's an outreach home group being set up. So the "you said we did" seemed very, very strong in the fact that they'd already heard this from the initial outputs from our evaluation, even before dissemination time, that people were calling out for more home visits and that service has already been set up. So yeah, that change is happening because of the evaluation, I think.
And also some of the sort of local authority stakeholders that we're working with on various projects have a hunch about what they think is happening in terms of their services and how they're being perceived by service users and others involved. But of course, they need the research evidence in order to back up any decision that they make. So in some ways, it's sort of pushing at an open door. The people asked to be evaluated at a time when there's a real value in them being evaluated, which means they want it to impact on that decision-making process, hopefully. And of course, sometimes evaluation findings are not what people are expecting. That, again, I think is about managing those expectations from the start, so that, again, if you've got the right people involved right from the start, it's not going to come as a shock at the end and people trying to hopefully block the evidence being used in terms of changing services.
Thank you.
That's great, thank you. We've got another question from Karen about how do you manage consultation fatigue?
Yeah, great question. Amanda, do you want to go first?
Oh yeah, do you want me to talk about consultation fatigue? Right. For me, this was a really hard one because, as I said, I was an ex-alcohol user, and I walked into the first consultation with the ladies who were sex workers, and there was a young lady who's she hadn't got her meds because she'd missed an appointment, and it was all during COVID, and she was very chaotic and in a very sort of unstable state, really. And I sort of looked at her and I thought of my past, and it did bring up quite a lot of triggers. But then, so that first session was kind of hard, dealing with what was present in the room and trying not to let it affect me. But then when we went the second time, she was more stable, she was engaging, and I was sitting and engaging with her one-to-one. And she was actually the young lady who did the mindfulness colouring for us. She produced that lovely colourful picture that I put in the video. And I think it was just so nice to see her being helped by that service that I felt a lot better. So yeah, and there's also the backup. I mean, I've got a brilliant team behind me. And I've also got a supervisor that I can go and talk to. And should I need any resources, I've got the Hertfordshire counselling team and other people behind me anyway. So yeah, it can cause fatigue, but what is the flip side? Don't do it. And I think I wouldn't want that flip side. I wouldn't want to not go and talk to people because it might be difficult. I'd rather go and talk to them, to be honest, if that makes sense.
Yeah, it does, Amanda. And also in terms of fatigue of groups who are perhaps always approached by researchers or for their views, and fatigue in terms of, or burden almost, I think one of the answers there is to do with, again, knowing who the stakeholder groups are and having these kind of longer term relationships with communities, with organizations, with populations, so that it's not sort of parachuting in and saying, this week we want to talk to you about, and it being, here we go again, here come these teams who just want to know what I think, and then they move on. And then they never hear what the feedback is as to what happened as a result, which is why we're not taking that approach, because I think that does help prevent fatigue or burden on the communities or population groups that you're trying to work with, and they can also then be more transparent about when they have had enough, actually, and that's fine. But again, so I think it is all about those relationships. I think that's why I feel really strongly about evaluating and using that kind of relationship building as a measure of impact, because I think it's really crucial, because without that, you're always second guessing what is it that a community wants, and coming in and out is not that beneficial.
Yeah, and BASIS, the organisation, don't normally let researchers come. They very, very rarely work with consultations with researchers, but they saw what we were doing, and they saw the first, and they saw the value in it, before they invited us. So it was really, really good to be welcomed by them.
Oh, that's great. I'm wondering, is there kind of a mapping across the region of what PPI groups are available, more sustainable groups, rather than forming new groups that people could kind of access or understand who the ways into those pre-existing groups?
There used to be when Involve existed. Now, I think, I mean, you can use that, the volunteer organisations, which most places have their voluntary service organisations and whatever, you can get to people that way. Yeah, it's a tricky one, because the thing is, if you're going to sort of set up organisations, you might not reach the diversity that you'd like. So, I mean, as I said, I was at the beginning of patient public involvement in research that started 20 years ago in Norwich, and that's what started me doing the PPI journey. But that group were not very diverse. That was the problem with it. It was because a lot of the work wasn't paid, and so it attracted the people that could afford to do the work for nothing. So it did lack a diversity. So I think sometimes if you think of different ways of involving people, so if it's not a sort of long-term thing, so what we've done on the FIRST is we've got a public involvement in research group that runs across all the projects. And then to get out to the service users in the areas, we're doing more like a consultancy model. Rather than all the way through, we're coming in at various key points with them.
I think you do need a mixture of, I mean, university public involvement groups like Hertfordshire and most of the universities got, I think, with, as Amanda said, other groups of service users and ways of consulting, so that you've got that mix, because otherwise you are always going to the same people and you don't get that diversity. And Julia's mentioned in the chat about Tracy Johns at Essex being a good link, because yeah, we perhaps do need better visibility of what groups are available, and they aren't the only solution, as I've just said, but it would be really useful if people are at least aware of the different routes in each part of the region that they could go to. Maybe that's something we can work on in Fresh, Caitlin, actually.
Yeah. That sounds good. And Julia's also just really usefully shared a link, which I'll share after the session, for NIHR guidance, which was published yesterday, about payment for public involvement in research. So I think that'll be a useful resource for people as well. So I think we're just in the last minute of the session, and yeah, it was a great presentation and great discussion afterwards. So we'll share the slides after the session and the links provided. And I just wanted to say thank you so much to Wendy and Amanda for such a sharing all your learnings. I think it's really valuable for everyone. Yeah, thanks for a great session.